There were angry protests today outside a crucial meeting in Dorset where the final decisions were being taken on a major restructuring of NHS services which will shape the future of healthcare in the county. The major changes will see the closure of Poole Hospital's accident and emergency unit, making Bournemouth the main emergency hospital for the county, and maternity and childcare services at the Dorset County Hospital in Dorchester will be shared with Yeovil Hospital in Somerset. Today's decisions are intended to save the NHS £150 million over the next 4 years. Our health correspondent David Fenton has been following the story. And David, how have these changes gone down?
Well, Laura, there were 32 recommendations that I counted today at the meeting, and they were all approved unanimously. There wasn't really much of a debate about them. There certainly wasn't any dissent, certainly not inside the meeting. Outside, where there were protests going on, it was a very different matter.
Something strange is happening here today. It's a meeting of the CCG.
It looks like a joke, but they're being serious.
Hospitals will close. You'll see.
These protesters are worried about changes to their hospitals, maternity care and community beds.
So we've got to save the NHS, and we've got to make sure that people can be near their children when they're sick. This is very, very important.
It'll affect people from an A&E point of view, especially those living in the middle of the county with the extra journey time to get to Bournemouth.
If you've got a heart attack from Corfe Castle, they reckon they can do it well within the hour, and if necessary use helicopters. Well, they're going to need a lot of helicopters if you've got more than a few heart attacks.
Imogen Hegarty didn't have a heart attack, but a perforated appendix. She waited 3 hours for an ambulance to reach her in Swanage.
She was drifting in and out of consciousness and struggling to breathe, and I called them yet again, I think probably 4 times I called them, and I was begging them down the phone to please send someone now because I was worried she was going to die.
In the end, Imogen got to hospital and recovered, but the worries remain. At today's meeting, every recommendation was unanimously approved. It'll mean an extra £60 million investment for Poole Hospital.
It does mean very significant investment, which we do need. It'll mean expanded day case facilities, expanded theatres, improved infrastructure, and we're hoping a new main reception as well.
For Dorset County Hospital, it'll mean teaming up with Yeovil for maternity care.
Because of the travel times at the moment are long enough in an emergency situation, and if we have to drive to a hospital further away, possibly Yeovil, it's going to be too dangerous.
These changes will now happen, but the concerns won't go away. David Fenton, BBC South Today.
Well, on a positive side, if I can put it like that, these changes are going to mean a huge chunk of money coming to healthcare in Dorset. £60 million to Poole Hospital, as we've heard, probably about £80 million for the Royal Bournemouth. And I spoke to the chief executive here, Tony Spotswood, about 30 minutes ago, and I asked him what he felt of people's concerns that they wouldn't be able to get here quickly enough in an emergency.
I think it's quite natural to be fearful because in some cases it does represent change, but I think we have to come back to the fact that if the most acutely unwell patients are already coming here from all over Dorset and their outcomes are really good, then people should take comfort in that.
Now, if these changes work as they're meant to, they'll take about 50,000 people out of A&E every single year. They'll create new community beds, more maternity services, and also a big change in mental health care with 2 new retreats being built, one in Dorchester, one here at Bournemouth.
David, thank you.